Okay,
You're good.
so we'll call to order. Can I have the roll call, please?
Dr. Moore,
Present.
Ms. McGregor,
Present.
Dr. Morrison, Ms. DeWitt,
Here.
Mr. Adamson,
Here.
Mr. Griffith,
Here.
Ms. Johnson.
Okay, I do believe we have enough for a quorum. All right, so we'll go ahead and get started. Do we have any additions to or adoptions to the agenda? Okay, since we don't have any additions or modifications, can I have a motion and a second to adopt the agenda?
So moved.
Second.
And I'll have a voice vote. All in favor, say aye.
Aye.
All opposed, same sign. Okay, motion carries. I would like to have approval of the last minute meetings from June 16th. Are there any additions or modifications that we need to make after you read the minutes? Okay, can I have a motion and second to adopt the minutes from last?
So move.
Second.
Any discussion? Okay, can I have a voice vote for approving the minutes? All in favor, say aye.
Aye.
All opposed, same sign. Okay, motion carries. All right, moving on to public comment. Okay. We have
Nobody's out there.
people. Okay, so, Shannon, we don't have any people, so we'll just move on past that. Okay, we're down to old business. We officially have no old business. We are just
Zooming
flying.
through it.
Alright.
Keep going.
Okay, new business.
Yeah.
Okay, well, Megan, tell us about the sewage variance.
Yep. All right, so tonight we are proposing a sewage variance request for 2794 Springfield Jamestown Road. The owner is requesting a variance to install their new discharging system approximately 3 feet from their home. Code requires a minimum of a 10-foot distance, isolation distance. They're requesting this variance due to the lot limitations. It's a very small and narrow property. It's only about 0.34 acres. We are requesting the 3-foot variance due to still wanting to maintain the isolation distances to property line, right-of-way, a utility easement, and also maintain a distance from their private water well, and all the hardscapes that are already on the property. We have reviewed this request and would not be opposed to you guys approving the variance as is.
There's no public health concern about the people living there.
Okay, so I'm gonna ask for a motion and a second approving a sewage variance at 2794 Springfield Jamestown Road, Springfield, Ohio, allowing a portion of the sewage treatment system to be present less than 10 feet away from the foundation of the home with the responsible party signing a hold harmless agreement.
So moved. Second.
Are there any discussion?
Just a question. Normally, it's a 100-foot setback from your well, is that correct?
A 50-foot setback.
50 is all,
50-foot
okay, I was,
setback.
okay, thank you.
Okay. So we have a motion and a second. We have roll call?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay, motion carries. Megan, we have a solid waste nuisance at 3630 Old Clifton Road.
Yes, so the CCHD has been working on the solid waste complaint since March of 2026. The home at this property caught fire on February 21st, 2026. And we began our investigations on March 4th of the same year. We observed burned and a gutted house, a large amount, there's several pictures in the packet, I should have said, sorry. A large amount of scattered burned household rubbish, and there's piles of solid waste, scattered litter, and construction and demolition debris really all over the property. At the beginning of these investigations, you can see that there are were campers on the properties. The campers have been removed. But over the past several months, there's been no significant improvements, and actually it's gotten worse in a lot of ways. The owner has never been on the site, but there have been friends at the property saying that they're trying to clean up, but no progress has really been shown to us. We went out to the property today to confirm that, and the condition of the property remains the same. So we would recommend that the board declares this property a public health nuisance to prevent the risk of the attraction of pests and rodents and possible odors that may come, and require the property owner 21 days to abate the nuisance.
Okay. So I'll ask for a motion and a second to declare a public health nuisance, 3630 Old Clifton Road, Springfield, Ohio.
So moved. Second.
Okay, is there any questions or discussion? Ms. Hackathorn, can we have the roll?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Motion carries. Ms. Megan, cost of nuisance abatement assessed to property taxes.
Okay, so the first one we're gonna bring to you is actually a property that you may or may not remember, but it's 210 Meadow Lane. So we declared this property a public health nuisance back on December 18th of 2025 for the aerator not working properly. Specifically, it did not have chlorine tablets in the system. And after discussing this property with our legal counsel, we were advised to seek the abatement of the nuisance under the ORC 3707.02 by contracting with a service provider to abate the nuisance and assess the cost to the property taxes. We did receive estimates from 2 different service providers to abate this nuisance condition. So we are asking you to certify that the board furnish the material and labor and cause the work to be done to abate the nuisance at 210 Meadow Lane, and furthermore certifying that the material and labor costs have been itemized and paid on warrant to the county auditor.
Okay. And then we will charge that to the taxes.
Correct.
Okay. All right, so could I have a motion and a second certifying that the board furnish the materials, labor, and cause the work to be done to abate the nuisance at 210 Meadow Lane, and furthermore certifying that the materials and labor costs have been itemized and paid on warrant to the county auditor. Further, in accordance with ORC 3707.02, the board president certifies that the health commissioner and clerk attest that the cost to abate the nuisance is correct and directs the county auditor to place such costs against the property upon which the materials and labor were expended, which shall, from the date of entry, be a lien onto the property and be paid as other taxes are paid. Any questions? Okay, Ms. Hackathorn, can I have the roll?
Mr. Adamson,
So
Do we get a
moved.
motion?
I think we need a motion.
We didn't get a motion in a second.
Yeah.
So moved.
Good looking out.
Second.
Okay, now we have the roll call.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson. Yes. Ms. DeWitt.
Yes.
Okay. That's too much reading, I forgot. All right, Megan.
Yeah.
Unpaid sewage.
You're just full of good news.
Yeah, I sure am. All right, so also in your packet, tonight you're gonna see a list of 51 total properties that have not paid their annual aerator inspection fee to us or have provided us with a copy of a current contract with a registered service provider. These properties have a pre-2007 aerator, and code requires the current service contract or that they pay the local health department to complete the inspection for the year. All of these properties have received 3 notices to comply with these requirements, and after April 30th, a 25% late fee would be attached to the inspection fee. So tonight we're asking you to approve a resolution certifying the itemized cost of the unpaid operation permit and inspection fees in accordance with the ORC 3709.09 as detailed in the full resolution, listing the names, addresses, parcel numbers, and the amounts owed for the permit fees, inspection fees, and late fees.
Okay. So we have item C. D,
D.
unpaid sewage aerator inspection fees, assessment to properties. I'm asking for a motion and second to approve the resolution certifying the itemized cost of unpaid operation permit and inspection fees in accordance with ORC 3709.09 as detailed in the full resolution listing.
So moved.
Second. Go ahead.
Okay,
Jesse got that
all
one.
right. Any discussion? Can I have a roll?
I do have another question.
Certainly.
Would these fees be charged to taxes also? Okay. 210 Meadow Lane is on this list too.
Yeah, because it's up again for another inspection.
Any other discussion or questions? Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
Yes.
Okay. Grant submissions to Springfield Foundation. All that reading is getting to me. Ms.
Yes, I'll take. So there are 3 grant application summaries in your packet. They're for the all 3 of them are for the Springfield Foundation, so I'll go through all of them and it can be one motion. So, the first in your packet is, a new ask to them. It's to help support our isolation housing that we are putting behind the building that Chris is going to talk a little bit more about in his update. So this is just to help fill the gap on some necessary things that we need, like bed and linen and things like that, so someone can safely move in there. So we're asking for $2,000 for that program. The second one is a repeat that they've given to our Start Strong Clark County, which is our infant vitality coordinator position. We're asking for $5,000. We've gotten that the past couple of years. So we're asking for that again as well. And then the final ask is for our diabetes self-management education program. We're asking for $5,000. Again, this is another one that they have funded in the past. And it supports the staff time and supplies for our diabetes support groups and education programs that we do through the health department. So if you have any questions, I'd be happy to answer, but those are the 3 for Springfield Foundation, and we're asking for a total of $10,000.
10 or 12?
12.
12, sorry. Yes, 12, my mistake, sorry.
Okay.
2, 5, and 5.
Asking for a motion and second to authorize the health commissioner to do all things necessary, including submitting the grant applications for the 3 grants that we just heard of.
So moved.
Second.
Okay, is there any questions? Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay. So, we have, Mr. Cook, who is going to talk about certification of insufficient funds and levy renewal requests.
I feel like Groundhog Day. I feel like we did this last month. We did do this last month. Now let me tell you why we're doing it again. So following the board meeting, we took the letter that you saw and approved last month, the certification of insufficiency of funds, took it to the county commissioners. By statute, I'm just going to say it, they have to rubber stamp it. They don't have a choice. They have to pass it along. Grace and I went, presented to the county commissioners, went great, had a couple good questions, handshakes all around, good luck. Left there thinking we're good to go. The way they wrote the full version of the resolution, there were some questions by the county auditor, some of the things they wrote in that resolution, because the county auditor has to certify the levy and define how much money that it's going to generate before it goes to the Board of Elections. County auditor said, hey, I don't like the years that you put in there. So they came back to us and said, hey, you wrote your letter wrong. I said, no, I didn't. And so then the lawyers get involved, right? County commissioners, legal counsel, our legal counsel, which is the prosecutor's office. And they interpreted our letter differently. I'll use that word, differently than what was intended. When we said, and you have a copy of a red-lined letter that you're going to read off tonight with these changes here.
Oh, yeah.
We originally said we are certifying the insufficiency of funds for the years 2028 through 2032. That's when we need the money from a new levy, right? If you know about your property taxes, they're collected in the year prior and then paid. You know, I don't know if you all got your bill, got my bill, paid it for the last half of last year, right? And so they interpreted this as, oh, so we'll collect in 28 for 29, 30, 31, 32, 33. But we didn't say that. We said we won't have money from 28 through 32. I'm not going to certify the insufficiency of funds for 27 because I'm sufficient, because we're still collecting on the existing levy. So they interpreted it wrong. They wrote the resolution with the wrong years. So they made it 29 through 33. Their lawyer said, it's not going to work. And I will tell you, their lawyer is looking out for the best for us. They are making sure that there's no technicality. This says, hey, your levy was on the ballot, but it's no good. I appreciate him doing that. I also appreciate our lawyer who came back today and said, Chris, you don't even have to define the years for them. You just have to say it's a 5-year 1 mil levy, and that's all you have to say. So there's a little bit of back and forth on this. We don't really know how it's going to play out. The way it should play out is the auditor should just certify it, because they didn't even have to provide those years, whether it was 29 through 33 or 28 through 32. But this letter will leave no question, because down here I specifically said when we're going to ask them to collect and when we're going to receive it. So there's no question about this at all. So will we actually need to use this letter remains to be seen. But when I talked to Kadani, who's our lawyer at the prosecutor's office, he said, if you got a board meeting tonight, I like your changes, let's just go ahead and do it. It's going to go to them tomorrow, and then they're going to decide to either pass it as it was originally and move it along the process, or they'll say, thanks for the updated letter, it makes it more clear, we're going to make the adjustment next Wednesday at the county commissioners meeting, and then move it on to the auditor and the Board of Elections. Has to be to the Board of Elections by 4 p.m. on August the 5th. So we are watching this like hawks. So what I am asking you to do is the same thing that you did last month. Say, yeah, well, we're not going to have enough money without our levy for the years that we're operating, fiscal years 28 through 32, but collection starting in 27. So are there questions about that?
Okay, so I'm asking for a motion and second, approving the resolution certifying that the amount of money necessary to meet the expenses of the health department will not be forthcoming to the Board of Health out of the health fund for the year 2028 through 2032. And requesting that the county commissioner declare by resolution that it is necessary to levy a tax for the Board of Health to place a 5-year 1.0 mil renewal levy on the November 2026 ballot, with collections first commencing in calendar year 2027 and continuing in calendar years 2028, 2029, 2030, and 2031. And first received by the health department in calendar years 2028 and continuing to be received in calendar years 2029, 2020, 30, 2030, that's not right. 2030, 2031, and 2032. Are there any questions?
So moved.
Dare you.
Okay.
Second.
Okay. Could I have the roll call, please?
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson.
Yes.
Dr. Moore.
Yes. Okay, motion carries.
You need a second bottle of water tonight.
Okay,
I'm so sorry.
I was like, I don't think I have to read the rest of these. Praise God for that.
Small.
Yes, exactly. All right. Personnel policy updates. Mr. Cook.
On your iPad, you will see an update that basically strikes out all one sentence and adds a whole bunch more sentences. This is the section that has to do, we're renaming this actually from TB testing to immunization and health screening requirements for employees. Sent this to the Personnel Committee. Appreciate a couple responses we got back on that to take a look at this ahead of time. I think it's always good to understand, as I told the Personnel Committee, the why behind this. And the why is really based on as much about risk to our staff as it is to the risk to the public that we serve. Truly, I do not want on the front page of the paper one day that measles was transmitted to an 11-month-old by one of our staff. I don't know how more plainly I can say that, but that's where we're at. I know we shouldn't be talking about measles and polio and things like that, but we're here. So what this does is a couple of things. It does require new and existing employees to demonstrate proof of immunization against Tdap, MMR, and varicella, and either provide that proof of immunization or they can get titers for existing staff that we have right now. We'll pay for the titer if you can't find immunization records. I think that's the fair thing to do because it just feels like the fair thing to do. For some other groups, as you see in here, employees working in clinical roles, we would like them to provide proof of Hep B vaccination. We're not going to require it though, but they're going to have to sign a declination waiver. That is truly based on risk to the clinical staff. For environmental health staff, we're asking also for Hep A as well. And again, a declination waiver can be signed there. Looking across the rest of this, we've got some information in letter B about tuberculosis, screening within 30 days of employment, and then annual for some folks that work with high-risk populations. We define what those positions are here and what those risks are. It also goes through a little bit about getting treatment for active TB or latent TB. This is based on experience that we have had here. And then finally, in letter C, we talk a little bit about our environmental health folks either having the rabies vaccine if they have the rabies vaccine or getting an antibody titer 1 year following the completion of that series. So really this creates a baseline of what I believe should be expected of public health. We need to practice what we preach, and we need people who are here for the mission and are mirror that mission that we're telling everybody else that is good health practice for themselves and their families. So be happy to entertain questions on this. This has gone through core team. We talked about this at a couple different meetings. This has been through legal too, to make sure that we can do all this. And we got the thumbs up in writing that we can do everything that you see in this policy. So
Is this reflected in their job description? Is there or is it handed out
not
to
in the-
them?
no, it'll be in the personnel policy and they have to sign off that they read and agree to comply. Same way that they would, we're tobacco-free, nicotine-free workplace, same thing. They sign off that, they read that and understand that.
We'll add it to the pre-interview, so they'll.
Oh, yeah.
They'll know up front.
Yeah.
No, it's not, because as of right now, it's not required, so it's not part of it.
Right.
And so you'd run titers on the current employees, which would show immunity.
Yes.
So why not run titers on new employees? Okay, because, non-clinical, so don't judge. But can someone get an immunization and still, or, not be immune,
Yes.
right? So a titer is the true way to, okay, I don't want to incur more costs, but
Generally speaking, for our setting, the health department setting, I'm very comfortable with accepting either a record or drawing titer. Hospital setting, probably it's.
Yeah, we run titers.
And I think the difference is for existing staff, we'll pay for the titers. Any new onboarding staff, if they have a titer showing, we'll accept that. They would just have to pay for it.
And we talked about this with Cheyenne. If someone doesn't want to go through the cost or expense of doing a titer, they can elect to get another vaccine. There's no harm in it. These in particular that we're talking about, and that actually is our expense. That's already in our personnel policy that you can get an immunization here at no expense to you. So.
Thank you.
I think it's a great thing if you're coming into healthcare and you have risk to you, and also to taking care of patients or clients. We don't want to present a risk to them. And I've always been in healthcare, it's a requirement, so.
It's modeling the behavior we expect.
Okay, so, personnel policy update, asking for a motion and second to approve the updates to personnel policy as stated by Mr. Cook just recently. Okay.
Second.
Okay, any additional questions? Okay, Ms. Hackathorn, can we have a roll call, please?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay, moving on to staffing changes, Ms. Hackathorn.
Thank you. You can see we had a few resignations, but then some new hires for nursing. Cheyenne's not here, but she did have 2 new hires, an LPN and RN for the RHW and immunization program. So then, of course, the few job listings to fill those resignations. All I have.
Okay, could I get a motion and second for appointing new employees to the public health services?
So moved.
Second.
Okay, second. Okay, any questions? Okay, roll call, Ms. Hackathorn.
Ms. Johnson? Yes. Mr. Adamson?
Yes.
Dr. Moore?
Yes.
Ms. DeWitt?
Yes.
Mr. Griffith?
Yes.
Ms. McGregor?
Yes.
Okay, moving on to financial reports, expenses and vouchers.
Thank you very much. About 10 pages of expenses this month, $467,000. As I did last month, I highlighted the 10 largest for you in blue. Health insurance is 2 of the 10. The one that appears on the first page is our down payment basically for our new policy. It was misallocated into our 8201 general fund. It needs to be moved, and it will be via journal entry into 8299, which is where the other health insurance payments come from. Couple of translators are often big expenses. 2 of our 10 biggest expenses were in Fund 8225, which is our water pollution control fund. Please, Megan, correct me if I get this wrong, but it's a program that the Ohio EPA is involved in. They help people who are in need of septic replacement with the process. We pay for that and then get reimbursed those amounts from the Ohio EPA. And then 4 of our top 10 expenses in our prevention and linkage to care account. This is a grant. The bottom 3 they're at 8265. There's one for 10,000, one for 25,000, and another one for 10,000. Those go to those counties that we contract with, and they are straight pass-through expenditures. We get money and we pass it on to them for them to provide a health navigator for the services. The rapid risk reduction expense. Can we talk about a health box? I can't. I don't know what the one box
Yeah, it's a
is.
1 box. So it's kind of, we've talked about the nalox boxes that we have in our lobbies, and they're out throughout the community. That's kind of like an AED, but for overdose. The 1 box is kind of a mini version of that, but they also have kind of step-by-step instructions like an AED. So we, as the regional lead for the linkages grant, worked with all the counties to see how many they would want so they can distribute those into their communities, and then we bought them and are distributing them out. So that's what that is.
So I'm asking for a motion and a second to approve the expenses and vouchers for May 2026.
So moved.
Second.
Any questions? Ms. Hackathorn, roll call, please.
Mr. Adamson?
Yes.
Ms. DeWitt?
Yes.
Mr. Griffith?
Yes.
Dr. Moore?
Yes.
Ms. McGregor?
Yes.
Ms. Johnson?
Yes.
Okay. Do we have any transfers and advances?
We do not.
Okay, so we're just gonna move on past that. Monthly budget.
Okay.
Okay.
After those 10 pages of expenditures, the same 3 I usually give you. The general fund report, which shows budget, year-to-date balance and activity for the month. If you look at it, we're about halfway through our expenditures for the year in the general fund, just over halfway through, about 50% of our revenues, just over 50% of our expenditures. In the general fund, 60% of the expenditures in the general fund have been transfers and advances to help support other programs, other funds. But that one is just, our largest unencumbered fund, unregulated. Next one is fund by fund, cash basis, beginning of the year, current receipts, current expenditures, and where they are today, right? Goal is to have all of those finish in positive figures. And then the ever exciting sheet of many colors. And I'm kind of taking a journey on this, and I'm sorry, I'm taking you with me. I'm really trying to figure out the best way to present this. And for the last 2 or 3 months, I've been including the transfers and advances in with the receipts and the expenditures, like netting them out. And I don't want to do that because I feel like it somewhat misrepresents those numbers. So what I've done, I start with beginning cash balance. I have your year-to-date receipts, your year-to-date expenditures. Those are all exactly what's in our books, our ending cash balance. And then if there is transfer and advance activity, that's on the far right. 8201 has the brackets around it, that's a negative. We've transferred money out. All the others have had transfers or advances in. Those numbers aren't included in the top portion of the page, but they are down below where I calculate the bar graph. Right, so the bar graph is, I'm not overinflating revenues, I'm not overinflating expenses by moving money from one fund to another on the bar graph. I did have a spacing, I followed this thing for a while and I failed. I did have a spacing issue with the bar graph. I need to point out that the 2026 revenue and expense is, that revenue number is about 5.3 million, right? It looks like we're ahead of last year. Last year was actually 5.7 million. The scale doesn't match on these two, and I apologize. We're about 400,000 behind on revenue from where we were last year, and we're about 300,000 behind what we had spent last year. And we talked about that the last couple of months. Most of that is due to the funding that was available last year that isn't this year. I promise I'm just trying to find a format that makes sense to everybody. I'm not trying to overly complicate it, so.
Well, I actually like that you put the transfers and advances out to the side. It did make it
A
clear
little easier.
and clearer.
Good.
Yeah.
Thank you.
Okay, so there's no action here.
I do have a question.
Yes, please.
It may refer to advances and transfers as well, but when you rebudget the health insurance that's currently in 8201 and that
Yes.
goes to payroll, will that?
That will reduce expenditures in 8201.
But it will make this red number of the payroll clearing fund, 8299, more red.
Yeah, it will. When we create the budget, we put any place that benefits get paid out of. So 8201, we have payroll come out of 8201, we have payroll come out of 8202, 8203, et cetera, et cetera. Every place that we put in payroll, we also put in a line item for benefits, health insurance, Medicare, workers' compensation, all those things. When the auditor's office does the journal entry that makes the magic happen on payday, when they do that, they pull out of all of those budgeted funds, and they move it into 8299, and then they dispense it out of 8299.
Okay.
So it will make that number bigger, but there is money coming in every time we get paid to offset that.
Okay. And does that show in our transfers and advances usually?
It does not.
Okay.
It's an excellent question. I welcome all of them. Thank you very much.
Okay, all right. 2026 second amended budget certificate.
I'm still up.
Yes, you are.
Megan, I feel your pain.
I know.
Okay, this one, our 8218 lead fund, this is the first year of its existence. It coincided with a grant, and at one point in time, we were paying it out of 8201, but for better tracking, we split it out into its own fund. We created a budget based on what we thought was going to happen, and we were pretty close, but not exactly. So what this amendment is doing is asking you for permission to spend, well, to increase our budget by $7,365 in this fund. The money's in the fund, it's just not in the budget. Right? We do not budget every dollar that we have. So there is money to support it. We just didn't ask for it back in December when we asked you to approve the budget. So we have a couple of expenses. If you look at the year-to-date balance, you may notice that they exceed the original budget, not by a lot, but salaries, PERS, that's employment, retirement, rather, Medicare, those are all very close. We need just a little bit more to cover the expenses there. And then we have a large purchase order of promotional materials that we want to cover as well. So because we are asking to spend money that hasn't been approved, we need to ask for approval of it now.
And I understand you to say that the $7,000 is already sitting in that pool.
We have the money, yes. We just didn't ask for it back in December when we created the original budget.
Okay. So asking for a motion and second to approve the second amended budget certificate as presented.
So moved.
Second.
Are any questions? Ms. Hackathorn, roll call.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor,
Yes.
Ms. Johnson.
Yes.
Okay. Public health team reports. Megan.
Hello again. Just a couple quick updates. We are currently interviewing for the EHSIT or the REHS position. Allie Hunt resigned from her position effective last Friday. Hated to see her go, but we wish her well on her next endeavors. And really, the biggest thing for us right now is tomorrow is the start of the 2026 Clark County Fair. So majority of our staff will be out there and inspecting every food vendor at the fairgrounds. This year looks like about 68 vendors. So we'll be doing a full standard inspection on all the food vendors. So it'll be a long day.
Was it a taste test?
Not usually. Yeah, so
Okay.
it'll be a fun day, but the weather looks great. I think it's the best
Yeah.
proposed weather we've had since I've been here, so I'll take it.
All right. Any questions for Ms. Megan? Okay. Thank you very much. Nursing and clinics, Gracie.
Yes, I'm Cheyenne tonight, so, if you have a question and I can't answer it, I will find out and get that information.
Okay.
So the nursing, update is in your packet, goes over, clinic numbers and things like that. So again, if you have questions, please let me know. But the biggest thing, with the nursing update is the Q2 communicable disease report that's in your packet. So if you've had a chance to review that, there are some notes that I was provided by Kim Wise, who is our epidemiologist that puts this together. So thank you, Kim, for her work on this. So probably on the top of everybody's head is the cyclosporesis. On the Q2 report, we have 4 confirmed cases. So that was through the end of June. I touched base with our CD team this afternoon, and as of right now, we have 8 confirmed cases in the county, compared to only having 2 cases in the last 5 years. So both of those cases happened in 2023. So 8 might not seem like a lot, but comparative to years prior, it is. So as Kim said in her message to me, they keep trickling in. So the staff is working on that and going through all of the investigation and things that needed for those. A couple other things of note is our drop in chronic hepatitis B and chronic hepatitis C cases. So One thing is that the investigations for these, both Hep B and Hep C investigations, are very resource intensive. A lot of phone calls, providers, follow-up testing, things like that. So the CD team has really rallied around together and figured out ways to make it like efficiencies and things. So we actually have one staff member dedicated to these cases, and that has helped to ensure follow-up and things like that. So those cases are decreasing, so we're excited about those. And then also of note is the decrease in our sexually transmitted diseases through the second quarter of this year compared to last year. So some good highlights for that. Yeah, but if you have any questions, again, I'd be happy to try to answer them or get you the information.
Okay. Do you have any questions for Chris about nursing? Okay. Thank you very much for that nice report. Early childhood, Mr. Cook.
I get to be Lori.
Okay.
You've got Lori's statistics on page 79 of your board packet there. I'm going to share just a couple of quick things. We had a site visit from the Department of Children and Youth on July 6th. This was a scheduled site visit just to look at our program, make sure that we're doing it to fidelity, be good stewards of the resources, all that good stuff. Good marks across. We're waiting for the written report, but everything was great in our exit interview with them. After the exit interview, I asked for a side conversation with the folks that came because I'm interested in having more conversations up their chain of command to talk about specifically the future of the capacity of home visiting here in Clark County. On Lori's report, I'm going to draw your attention to one thing. It says families on the wait list. It's 0. It hasn't always been 0. It's fluctuated, been up, down. About a year ago, the state, through the governor's office, had a big push to expand our programs like Help and Grow and federal home visiting throughout the state. They asked for some expansion here in Clark County, and we looked at our workforce. We looked at there are other entities that do these programs in Clark County through the hospital systems. And we thought it was sufficient because we saw what was coming down the pike from immigration change at the federal level. And so the reason we had some of that blip increase on the wait list was immigrants that we were serving. And based on the stance and everything that's been going through the courts, I looked at Lori and I said, Lori, I think the population needs are going to change here in the next year. I don't necessarily want to jump and hire 3 or 4 more people and then have to eventually lay them off this year. And so we worked with some things. We increased a couple of part-time people up a little bit. We filled some positions that have been vacated that we had in the budget that we were kind of holding off on to get back to full staffing and then a little bit more. And the wait list was very reasonable. However, one of the other partners in the community that does this did take advantage of expanding and part of the hospital system. So they hired a bunch of people. And so the way this system works is all the referrals for these services go up to the state level for what's called central intake, and then they assign it to the entities serving the counties. And so when there's more buckets down here to fill, every bucket may not get quite as full. And so that's what we were experiencing. And now that you see our wait list is 0 and the hospital system wait list is 0, someone's got to shrink to meet what the demand is. And our question to the state leadership is, we've been doing this forever. We're the legacy entity here. Why should we shrink and not the people that decided to expand? Shouldn't it be like last in, last out, first in, first, that whole thing, right? So the people that expanded, shouldn't that contract first? And so we're having some discussions that make sure that central intake is doing appropriate referrals. And so they took that conversation back with them, and we have, we're working with the director of DCY, Department of Children and Youth, to get a conversation with them to talk about the future of it here. Because we feel very firmly that we are staffed appropriately for the need, and that other entities that decided to expand when it was, I feel like we shouldn't be punished for having our fingers on the pulse of what's really going on in this community. And so we're going to have those conversations to make sure that as the legacy entity here that provides the best service to these families, frankly, that we are the ones looked at to be long-term here. So I think that's going to turn out to be a good conversation if we can get some dates narrowed down with them in the next couple of weeks. One of the other things that we're looking at too is a program that's new in the state through DCY called Family Connects. It's an old program that's just been rebranded. It's newborn home visiting. Once upon a long time ago, we did that here at Health Department. We had nurses that actually went out and did newborn home visiting. And so this is the reboot of that program, also Governor DeWine's initiative. There have been a couple of phases of this grant application coming out, and there's another one coming out this fall, and we are going to apply for it because it fits right in with what we're doing already with Help Me Grow home visiting, federal home visiting. It all aligns very, very well. So we're going to apply, see if we can get some funds from that. It works well. I've seen it in another health department that I'm working on. They have it, and it's working well over there. So I want to bring that here potentially in this fall grant cycle that they open up. So I think that's it. Any questions?
Very nice. Any questions? All right. Okay, Emily. Women and infant children.
Thank you. A few items to share this evening. First, I would like to thank the agency and the board for the opportunity to attend the conference last week. I wasn't quite sure what to expect, and I was pleasantly surprised and found a lot of valuable resources and inspiration to bring back here to implement.
Yay.
And then next, we got our training for the new electronic farmers market issuance system. That was at the end of last month. As promised, we did get our benefits starting July 1st, and we started to issue those out, and we distributed about half of what we got. We received 22 $30 benefits to provide for participants, which isn't a lot, but it is 6 more than last year, so that's something. And then the report for last month, I noticed that I did not have the certification numbers in for May. So those are in for this month as well as June. So I apologize, I missed those last month. You may also notice there's a variance in the total number seen at the hospital last month in June. And this can be attributed to our summer staffing shortages. And this is an operational in nature. It's not indicative of a decline in community or need or interest. So just wanted to point that out. And then finally, I just want to give a special thanks to our part-time breastfeeding peer, Kia Robinson. Shannon mentioned, or it was on our resignations. She has been a great employee, and we just wish her the best. She's on to a new adventure in her life, so we wish her the best and just thank her for her service. So we have some applicants coming in, so we'll be doing interviews to get that position going. Wonderful. And that's all I have.
Okay. Any questions for Schaefer? Okay. Health planning.
Yes, me again. So you have the packet or the update in your packet. So if you have any questions, please let me know. A couple of things that I want to point out specifically is in August 31st, as you've heard me talk about for several years now, is Overdose Awareness Day. Globally, it's recognized on August 31st, and locally, we usually do an event around that time to honor Overdose Awareness Day. So the flyer is on the side there, but our event locally will be held on August 28th, which is a Friday, from 3 to 6 on the National Road Commons downtown. So we'll do Chalk the Walk again, so people can come and write memories of loved ones that have been impacted by overdoses. There's resources, and community and music and all of that stuff. So that is happening on August 28th this year. So I wanted to point that out. And then as Megan mentioned, it is Clark County Fair time. So not only do we have environmental health staff out at the fair doing inspections, make sure all the food vendors are safe. The health planning team mans our booth within the Mercantile building to pass out and give information out about the health department. We also do the breastfeeding booth that is next to our booth in there. So our staff will be busy next week out at the fair. And one thing through our Safe Communities grant is I think we had it last year, but the Arrive Alive demonstration presentation will be there on Saturday and Sunday. This coming, so the 25th and 26th. So it will be outside of the sheriff's department's booth outside. So what it is this actual car that people can get into, and it simulates distracted driving. So we are fortunate enough to be able to fund that through our Safe Communities grant. And then one thing that while we were at the conference, you get inspired and things are happening and you're thinking, and then you shoot emails off to employees that are back here and they're like, stop saying this. Yeah, right. So one of the things they were talking about people-focused social media posts, right? Like we do a lot of great work at the health department and we want to showcase it. And especially, coming time to levy to show what all services we provide to the community. So one idea that came to me was to do like a day in the life of the health department at the fair, following around, showing inspection, showing where we're set up at the booth, the breastfeeding booth, and maybe, put in some safety tips, like after you pet an animal, wash your hands, those kind of things. So we're working on that. So look out on Facebook and Instagram. We're going to try to become hip and relevant. I don't know. I'm not really those things. So yeah, we'll figure it out. But we have some staff that are excited. The health planning staff are excited to do that. So just one of those things. So just keep a lookout on that and come and visit us at the fair in the Mercantile building.
Thank you very much. Any questions for Grace? All right, legislative updates.
Well, just because the state legislature is in recess right now, doesn't mean I don't have anything, doesn't mean that I don't, public health is boring, because we've got explosive diarrhea and wildfires and all kinds of things happening in public health, right? So we have other things happening too. A couple of things happening in environmental health. We are in the process of taking some of your board actions and other people's inaction to clean up some properties and some nuisances. We're taking those to court. We have 3 of them. And by the way, it does cost a little money to file in court. It's $325 a piece. When we file in court, it does cost a little bit of money to get compliance. But for, like Megan said, the one that we decided to fix, our legal said, Kadani said, it's going to cost $325 to take them to court, or $91 just to do it and put it on their taxes. So that's why we did that. But for the other ones, it's way more than $325. So there's 3 of those that are being filed with courts right now. So looking forward to seeing some action from all of your action in those areas. If you haven't paid attention to news, you know that tomorrow TPS, the administration has gone through all the proper channels, and TPS does end for our Haitian immigrants tomorrow. So we'll be watching for what's going to happen in our community here. I wish I had answers for you or a playbook of how it's going to happen. But just our commitment remains that we'll serve anybody, regardless of their legal status, with the basic healthcare needs that we're mandated to do. So we'll continue to work with everybody as long as we can. A couple of updates on some projects. Talked about the security of this building and the doors we're putting with these little, the little things that you hit on the doors to enter. Almost all the doors are done except for the front door, and that'll be hopefully done soon. So as you exit here, if you look, there's a little doorbell, like it's like a Ring camera, right? It's got a little thing there. So when someone comes to this door and they need let in, they can push the button. Gracie and I can see who it is on the, the little screen, whatever. And so it's just going to improve our security here. So we're making really good progress with tech advisors on that. Speaking of other good progress, Gracie mentioned our isolation housing, our tiny home that we're putting here. Since you all know we continue to struggle with every time we have somebody to isolate for a disease, finding something in the community to lease or rent. As you leave too, you'll see there's a 3 or 4 bare spots out here where we cleared some trees. We're in the process now. You'll see some stakes out here where the surveyor has been out here. We're gaining a little bit of land on that side from the county commissioners for the grand price of $1 in exchange for an easement down Patterson Way here. And then we'll be able to put our home over there. We have the home, we put a down payment on it. We haven't closed on it yet, but things are moving along very, very quickly. The bid package has gone out for doing everything ancillary to it, including connection to water, sewer, running the electric from the pole. All that's been ironed out. We've signed all that. So in the next few months, we're going to be having our home here. I don't know if I mentioned it in the last meeting or not, but purely coincidental. The color of the home happens to be public health colors. It is dark blue and tan. It was not planned, I promise. But I'm going to say, yeah, look at that public health home right there. It's got the right colors. So,
Has anybody else done that?
Nope. A
That's
lot of
kinda
people in the
weird.
region are watching. They know, and they're
That's
kind of curious about how this is going to
Yeah.
play out. But I do want to extend another. So if you remember, we were given $100,000 from Community Health Foundation to be able to do this. The cost of the home was like 91 and change, but then the bid package to do all the connections to water, sewer, electric, all that, then increased the cost to around 129,000 or so. Went back to Community Health Foundation, said, hey, we estimated 100,000, appreciate the money, but could we have a little more? And within a week, they said yes. So they're giving us another $25,000. We could not do this without the Community Health Foundation. So appreciative of them and everything they do for us and everything else they do in the community. So
So the cost of that compared to, renting or, a
Yeah.
hotel or whatever will probably,
eventually,
eventually.
yes.
Not to
it's
mention
gonna-
the time that's.
Oh,
Okay.
yes, the time, I wish Cheyenne
Not
was
counted.
here, she'd be like,
Yeah.
yes.
Yeah.
It's
We get a call at
stress.
4:00 on a Friday.
Yeah,
And we have to scramble
Someone's
to
getting
find-
discharged from the hospital that we don't have any place to
right.
take them to
0.1
safely.
FTE
Right.
just to do this.
Right.
Sure.
Yeah. So again, just sincere appreciation to Community Health Foundation for that. Look forward to seeing that. And then our workforce grant, we did get a little additional money for our workforce grant from the federal government, believe it or not, one that's not going away. It is eventually going away. We got a little extra money, $240,000 to finish us out through November of 27. So basically, it's going to allow us to continue to pay the programs that we already had in that grant through November of 27, and then it goes away after that. So very appreciative to Ohio Department of Health for doing some reallocations. Frankly, what they did is the state got some money, and then they had some for the locals, and they took a look and said, hey, as a state, we're not going to spend all this, and they reallocated to the locals, which is kind of unheard of and crazy, which is, again, why we're very appreciative of that. Rebranding is going. It's slow going, but our new domain is live and active as of yesterday, and people are logging in with their clarkhealthohio.gov domain. And so you're going to start seeing some physical changes to the building. We've got all those bids back in, and we're ready to start making that happen. So you will start seeing the old logo replaced with the new one in the next few weeks. And then one final thing, probably not on your bingo card for me to talk about this year, but I want to talk about daylight savings time. I don't know if you've paid attention, but there are two kind of dueling bills at the federal level. Congress has gotten as far as it ever has with actually deciding we're going to stick with standard time versus permanent daylight savings time. You might say, Chris, why are you talking about this? Your public health? Well, this actually has to do with public health and our circadian rhythms and all that good stuff. We know that when we spring forward, if you look at the statistics, the week following us springing forward, changing our clocks, there's a 6% increase in fatal car accidents across the United States and a 6% increase in workplace injuries. For about a week while everyone kind of gets used to that. And so you might think, oh, 6% for a week, not that much. But if you multiply that by the fact that we have 330 million Americans, it becomes significant. And so there's all the studies show that permanent daylight savings time is poor for public health. And so that is actually the bill that is in front of Congress right now. If that goes down, there's a bill right behind it that is the opposite, would make standard time permanent. So they're considering making daylight savings time permanent, but if that fails, they're gonna try standard. I think we can all agree based on those statistics, a 6% increases, there is a public health effect, there's a physical effect on Americans by changing clocks. And so I think everyone agrees we need to make a change. I will tell you from a public health standpoint, it needs to be standard time. If you look at the urban United States population experiencing sunrise after 8 a.m. on the summer or the winter solstice, during our current system, 97% of urban population experiences sunrise after before 8 a.m. If we switch to permanent daylight savings time, 87% of the population will have it after 8 a.m. And so by switching, it will be darker in the morning, longer. Now, you might not know this, I didn't know it until I started reading about it. In 1974, Congress actually passed permanent daylight savings time. And after 10 months, they undid it because everyone got angry about it, because we started seeing increase of children being injured while walking to school because it's darker in the morning. There were so many things, and for once, the majority of America actually had an impact on something that Congress passed. So public support when they did that initially was 79% of the public supported permanent daylight savings time. After 10 months, and then they repealed it, only about 42% of people supported it because what they saw happening, the things that happen anyways when we do daylight savings time, right? So switching, if you might ask yourself if switching is the problem, isn't permanent something better? Yes, but it's standard time. It's not permanent daylight savings time from a public health standpoint. We can't ignore the reasoning behind permanent daylight savings time. You can definitely argue one side that it's better for businesses. The longer it's lighter, people are out more. There's benefit to that for businesses, agriculture, things like that. But when it comes to a public health standpoint, our stance is standard time is actually better. So it's not too late to contact our federal representatives to let them know that we would support making standard time permanent, not daylight savings time. So that's it.
Okay, any questions for Chris? Executive session, we do not need executive session. Any additional business you want to talk about while we're here? Okay. So our next meeting will be on August the 20th at 6 p.m., the same location. Please mark your calendars. And if no one is objecting, I'd like to have a motion and a second to adjourn the meeting.
So moved.
Second.
Okay, can I have a voice vote? All in favor, say aye.
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 All opposed? Okay, meeting's adjourned.